Thank you for tuning into this video about our hospital. I think it's really important if you came here as a resident that you had an idea of the learning environment in the hospital. So today I wanted to introduce to you Cassie Lanning, one of our physicians, third-year resident, who's going to share some about the hospital. So Dr. Lanning, thank you so much for joining us. I just wanted to start on a big picture, and that being the hospital as a whole and the campus that we're on in the residency. So if you could share about that, it would be awesome.
Absolutely. There is one thing that I have really loved about my experience at Gunderson, and that is the proximity of your continuity clinic to the hospital, including your inpatient medical units, your obstetrician or OB unit, and your pediatrics unit. Within a 5-minute walk, if you live in residency housing, you can get to almost any side of the campus. Our clinic is connected to the general hospital by both a skywalk and a tube system that allows you to get anywhere you need to within just a few minutes, all while staying dry and warm.
Great. Thank you for sharing about that. The next area of the hospital I want to talk about was the obstetrical unit. Cassie, I know you do obstetrics. You're planning on being a full spectrum family physician. So you would be a perfect person to tell us what the labor units were like, what your experience was like there, and what the relationships in the obstetrical floor are like.
Yeah, absolutely. The obstetrics unit we have at Gunderson is really top-notch. The rooms are all individual rooms where you start with your labor and delivery in one wing of the hospital, and then after a few hours of care, you get transferred to our postpartum unit, which is equally beautiful. The rooms are very spacious. There is lots of room not only for the nursing staff to easily do their jobs, but also to have the attendings and the residents and students all within the room having equal space and not feeling like you're on top of each other. As a patient in the obstetrical rooms, I can tell you that they're very comfortable. The nursing staff is amazing to work with, both as a patient but also as a resident. And the other great thing from a resident standpoint is right outside of all of the labor and delivery rooms, there's a small cubicle where the midwife, the obstetrician, and family medicine attendings can all sit next to each other, which really is very important for collaborative care. It also allows us to be right next to our nursing staff, so anytime there's a concern, we're able to talk about that person to person without having to travel distance, which is really important, especially when you want to have quick conversations to get things done.
Thank you. That's great. We want to move just down the hallway just a bit. You had mentioned labor and delivery and then moving right to pediatrics, which is just a very short walk, maybe even a minute to the peds floor. And the experience you get doing newborn pediatrics and sick children pediatrics at our center.
Yeah, so the pediatrics floor is 2 hallways. One hallway is generally used for our newborn nursery care, our postpartum care. The great thing from a patient standpoint, most of our beds are double, so both mom and dad can sleep in the same bed, which is very similar to how you would at home. That's a really big thing for a lot of our patients that they like. Also, on the other side, in the sick kiddos unit, you have great access to your nursing staff right in the middle. From a resident learning standpoint, there is a teaching room right on that floor where you can sit down to do all of your notes, but also get time to talk with your attendings to do some scheduled learning, which is very important.
Great, and I know you have 3 months total doing peds and sick children and newborns per year. Moving down then, you know, our medical floors are really wonderful, but they look like hospital rooms. I just wanted to talk a little bit about an ICU experience because every intern does a month of ICU. Maybe you can share just what that environment in the ICU is like.
Yeah, so our ICU experience is definitely eye-opening and very, very important, I think, as a resident. I learned a lot from there. The ICU is a closed unit, which means that the ICU attendings are the ones in charge of your patients, which is really great in terms of you know who to go to when you have questions. In the ICU, we do have a resident workroom, again, where you can sit quietly and do your notes, but also it gives our attendings a time and a place to go and do specific teachings, which all of our ICU attendings take great pride in and have been very, very useful. The nursing staff is right outside that room, so you have access to anybody you need to talk to. And our ICU rooms are actually quite spacious, very well designed. They have everything you could think of needing. And I think the staff and the nursing staff do really good at involving family members when we can to help transition with care. And overall, it's a really great experience.
Great. We at Gunderson have the only level 2 emergency room in the area, and I know that it's an important part of your training. It's everything there is really up to date, top of the line. Could you share your experience in the emergency room?
Yeah, our emergency room is very up to date and very well designed. So in general, all of the emergency rooms are located around the outside of where the nursing staff, attendings, and residents sit to do their work. This means that you have an easy in and out access, so you can easily get to patients quickly. But it also means that you have somewhat of a protective barrier, which from the emergency room can be very important. In that center pod, you have your nursing staff right next to you, your social workers right next to you. There's a pharmacist that's on staff during the day that you definitely will utilize while you're there. And you're sitting right next to your attendings, which is all very important for learning. Anything that an emergency room needs, Gunderson has, and Gunderson seems to have the best of it. I'm never wanting. We do have ultrasounds that you can wheel in to do bedside ultrasound in the emergency room, among many other things.
Gunderson really does pride itself on its learning environment. We have 3 great lecture halls that are set aside just for teaching, the Rasmus, the Overholt, and the Ross. Maybe you can just comment on those?
Yeah, Gunderson definitely is a teaching hospital, not only for residents and students, but for continuing medical education with the attendings here. We have dedicated learning space in 3 different lecture halls, all which have very comfortable seating and lots of room. We've utilized them a lot throughout our time here in training. In addition, we also have the Ice House, which is a simulation lab that is extremely high-tech and up-to-date that allows us to work on real-life simulations with patients, and that's something we use every year here as well.
Finally, let's get on to the most important thing, and that's food. As a resident, I know how important that is. Share how the residents use their food money and what residents really enjoy here as far as nutrition.
That's a great question. There's 2 main cafeterias. One cafeteria is open longer hours, and then there's a smaller cafeteria which is very conveniently located just a few floors down from our clinic. Both of those offer great lunch options and dinner options in the main cafeteria. But my favorite is definitely the Mocha coffee shop we have in the main hospital where we can use our money. There is nothing better than a nice warm coffee on a cold winter when you are a resident. And I definitely spend most of my money there. In addition to where you eat, we also have the ability outside of COVID hours to do workouts at the workout facility here at Gunderson, which for some people means you can jog while on clinic time or on hospital time, which is really unique and really, really loved by most residents.
Great. Thank you for sharing about our beautiful hospital facility.